I'm Dr. Victoria, and this is George.
I'm Dr. Victoria, and today we are joined by a very special guest, baby Endor. Baby Endor has just been born, and his parents would like him to have a circumcision done. Circumcision is the removal of the foreskin, also known as the prepuce of the penis. Medically, we really do not need to perform circumcisions, but there is a modest medical benefit. Sometimes there may be cultural or religious factors at play, leading a parent to make that choice for their child. For parents who want to delay circumcision until the child can make the choice to be circumcised or not, a circumcision at a later date has a much higher risk in terms of infection, post-procedural discomfort, and recovery compared to when it is done as a newborn. Some benefits to having a circumcision include a lower rate of urinary tract infections, penile cancers, penile inflammation, penile dermatoses, and sexually transmitted infections, including the transmission of HIV, HPV, and there is some evidence suggesting it protects against trichomonas and chancroid infections. It is not prevention, but it does decrease the risk of acquisition. During infancy, the lower rate of urinary tract infection is the major benefit. However, the risk is already quite low for male infants to even get urinary tract infections. As well, there is easier hygiene, especially for the young boys, and they should be instructed to wash under the foreskin if they keep their foreskin. However, infants should not have their foreskin raised, and parents can just wash the penis as they would the rest of the body with some age-appropriate soap and water. Risks of doing a circumcision include bleeding, though this is usually minimal. We can apply a wound seal, a hydrophilic polymer and potassium ferrite combination, which looks a little like black powder on the penis, but this helps to control the bleeding. And while it may be alarming for parents when they see this, it helps decrease the bleeding. Rarely, a stitch may be needed. If a circumcision is done, but there is hypospadias where the end of the urethra is not at the tip of the penis, we may need to abort doing the circumcision and instead place a stitch to close up the foreskin. This is because the foreskin skin will be used to repair the penis. There is a risk of infection, as this is an open wound and in a dirty diaper environment, so clean diapers are best. Parents should be encouraged to change diapers frequently. Other reasons a circumcision should not be done is if there is agenesis of the kidney or there is polycystic kidney disease. A urologist should be consulted if this is the case, and they may still go ahead and do the circumcision if it is still desired for the parents. As well, during the procedure, there is the risk of injury to surrounding structures, removal of excessive skin, which could result in a denuded penile shaft, and complications from the anesthesia used, the lidocaine. In the past, there was a concern that the stress from the circumcision affected breastfeeding. However, this does not seem to be the case, and any changes in infant behavior do not last longer than 24 hours. Overall, most infants tolerate the procedure well, and these risks are quite low, but they are important points of discussion. There are several contraindications to performing a circumcision. If a child is premature or in an unstable state, we will not perform the circumcision in the hospital setting. And in every child, we will wait until the infant is at least 24 hours of age before performing the circumcision. If the child has a bleeding risk, perhaps this is a family history of a genetic condition, we may refrain from performing the procedure. As well, if the child is at increased risk and parents declined vitamin K injection, this may not be a safe procedure for them. If there is a congenital penile anomaly, such as hypospadias, a curvature of the penis, penoscrotal webbing, a buried or hidden penis, or a very large suprapubic fat pad, or if there is a micropenis, we would not want to do a procedure at that time. And instead, we will refer to a pediatric urologist. To perform a circumcision, we will prepare our supplies and tools for the procedure, including the Glomco clamp. we will be administering lidocaine, and we will make sure that we have the right size clamp for the head of the penis. It is pretty standard to pick 1.3, but depending on the size, if baby is larger, he may need a larger or smaller Glomco clamp. We can start by cleaning the penis with betadine. They were just born, so there are no allergies that we know of yet. And we will administer 0.2 cc's of lidocaine in the penis. Alternatives include a lidocaine cream or a mix of lidocaine 2.5% and prilocaine 2.5%. And you can do a dorsal penile nerve block, which is what we will do, applying 1% lidocaine without epinephrine at the 2 and 10 o'clock positions. We want to administer the lidocaine starting relatively low down. We do not want mom and dad to see puncture wounds where we went in with the lidocaine. The reality is many times this is a cosmetic procedure and we want it to look very nice. While the lidocaine gets to work, we can set up the rest of our field and supplies. We want to pull all of our tools out of its packaging and make sure that you have all of your tools if it does not come pre-packaged for you. I will need something to spread the penis head from the foreskin, as well as 2 curved hemostats. I will also need a pair of scissors, and I will want to undo my safety pin, as well as disassemble my clamp. Once I have my supplies prepared, I can begin by applying my 2 curved hemostats, curved upwards, so it is easier to pull the edges of the skin together later. And then going in with my straight hemostat to separate the head of the penis from the adhesions. I want to angle quite upward towards the ceiling when I separate the adhesions from the head of the penis. I do not want to damage the head of the penis, so I go superiorly and laterally, but not inferiorly. Next, I will take the straight hemostat and clamp at the 12 o'clock position of foreskin of the penis. I now have an indentation of skin that I can follow with my scissors. As well, I will decrease my blood loss by clamping the skin. I want to make sure I put the blunt end of the scissors towards the head of the penis, and I will make a cut in the foreskin. Once the foreskin is cut, I can pull backwards over the shaft of the penis and with some gauze make sure all adhesions are removed. This may take some time, and there may be a small membrane that needs to be pushed backwards as well. A little bit of gauze will help with this. Once the adhesions are removed, I can go ahead with my clamp. I will place the bell of the Glomco clamp over the head of the penis. Once this is done, I can pull my curved hemostats back up and around this portion of the clamp. I will use my opened safety pin to pin the 2 edges of foreskin together. Once this is done, I can apply the rest of the clamp and components as I feed the bell and the safety pin through the clamp. After I feed the safety pin and the bell through the bevel hole, I will then tighten the clamp as much as I can. Once you think you have tightened enough, you have to tighten more and then some more. Once the clamp is on, you can cut the foreskin off. You want to make long cuts. Doing short cuts is not ideal. Remember, we want this to look nice when we are done. And the shorter cuts can be not quite so visually appealing. Now that we have separated the foreskin from the penis, we want to leave the clamp on a little longer. This helps with bleeding once we remove the clamp. So I will take this moment to put my sharps away so that my nurses do not hurt themselves, and then I can come back and start taking off the clamp. I will remove the top plate and the bottom plate, trying to keep the bell of the Glomco clamp still under the foreskin. I will then use a little bit of gauze to carefully remove the foreskin from the bell. Now that we have removed the foreskin, we want to place a little bit of Vaseline on the head of the penis, a little bit of gauze, and tuck that baby back into their diaper. We will want to remind parents that they should change the diaper more regularly and check for wet diapers with greater frequency than they normally would during the initial healing period after the circumcision. And baby Endor has finished his circumcision. Thank you for joining me today, my healthcare team. Many families want to have their newborn boy circumcised, and what a special honor it is to be part of this tradition for so many families. I hope you'll join us next time. Bye-bye.